Hello. In this video, we will be talking about dreams and also about drugs. So there are several theories about why we dream. Sigmund Freud, the famous psychologist, basically a psychiatrist, honestly, known for the development of talk therapy, basically said that dreams were symbols from our unconscious that were coming out. And he used all sorts of symbols and came up with like ideas about what different symbols meant. He used them to try to interpret a person's internal conflicts. I'll say a little bit more about that in just a minute. If you look at some of the more recent and scientific reasoning about why we dream, it appears that really one of the things that dreaming does is keeps those synapses active, keeps the dendrites, and the terminal branches active. And so one of the things that when you look at that chart about how much babies dream, again, they're keeping their neurons active so that those will stay alive. So that as they're trying to make sense of their physical reality and being talked to and language, that they can use those neurons later on. Also, we know again that sleep and actually dreaming enhances memory. Let's see. Another thing, theory about dreaming is that, and this is the cognitive development perspective, is that basically we have these random firings of neurons that occur, and then our brain does not like to have so much randomness. I mean, we as human beings are storytellers, and we try to impose a meaningful story on what's happening in our everyday lives, but also with this theory of dreams is that when our brain is creating these images, we impose a story on it and trying to make as much sense as possible, even though I know a lot of my dreams seem like total nonsense. When you look at research on some dream falling is one of the most common dreams. And usually that doesn't even happen in typical REM sleep. That actually is a weird, almost flash dream experience that happens in another stage of sleep, which is kind of strange. Driving from the back seat in a car is usually and these are just things I pulled from my research on the internet, is usually representative of being out of control to some degree. Being chased is being afraid, that is a symbol of being paranoid. Have you ever been chased in a dream? Teeth falling out or crumbling. Some have argued that this is a theory that basically is symbolizing a fear of becoming less attractive or getting old. Nudity, or being in your underwear, like in your sleep in front of a crowd, feeling exposed and vulnerable. Lost, representing confusion. I don't know how many of you have dreamed about missing class. I used to have that as a student, now I have it as a teacher, but it's usually related to feeling like you're missing some opportunity. I'll talk about that later. Fly. If you're in a flying dream, usually that is a good feeling of being in. Sex dreams are just about sex, period. And other times just like really wanting a connection, which sex can be about too. If you look at sleep problems, sleepwalking is one that happens usually during slow wave sleep, like a stage 3 or stage 4. There's a myth not to wake up someone who's sleepwalking. I recommend actually doing it, and most psychologists do, and gently guide them back to their bed so that they don't harm themselves by tripping over something or something like that. There is a REM sleep behavior disorder. We have a structure in our brain which basically paralyzes all of our muscles when we fall into dream sleep, into REM sleep. For some people, this mechanism fails, and they just can violently act out some of their dreams while they're asleep. And people have been known to like punch their partners or to accidentally hurt whoever they're sleeping with because of this sleep disorder. Sleep apnea, you've probably heard about if you've known someone with a CPAP machine. Typically what happens during sleep apnea is a person will stop breathing for a period of time. The problem with this is they won't come fully conscious, but that this prevents them from spending significant time in deep sleep. So they're not having the restorative sleep and the body repair that's supposed to happen during stage 4 sleep. They won't know this until they go into a sleep lab, and then they can, measuring all sorts of EEG, their slow wave sleep and their breathing, realize you're not getting enough oxygen at night to be able to go into deep sleep. Let's see, SIDS is sudden infant death syndrome. I have this toddler here with a helmet on, R2D2 helmet. Basically, they now recommend that you put babies on their backs so that they don't develop the sudden infant death syndrome where they suffocate at night. And that actually the preventative measures they're taking with training parents to get their kids on their back to sleep has gone a long way to preventing SIDS. And then narcolepsy is basically a disorder of sleep attacks where a person could be engaged and then just suddenly overwhelmed with ultimate fatigue and actually just fall asleep within a matter of seconds. They usually use stimulants to treat that. Speaking of stimulants, we're going to switch now to drugs and talk about substance use disorder. Substance use disorder, as you can see here, is the new way of trying to diagnose whether someone has mild substance use or moderate or severe. And you can see all these on this list here, all the different symptoms that go along with substance use. Now, if you have 0 to 1 of these symptoms, then there's no diagnosis. 2 or 3, it's mild substance use, but you can see the symptoms here. I mean, using larger amount than intended over time, you try to quit but can't, excessive time spent using the drug, craving for it, failing to show up for work or school or class, continued use despite interpersonal problems, so fights with a partner, maybe DWIs, and then you have tolerance and withdrawal. Tolerance is the requiring more and more of a substance to achieve the effects that were experienced previously. So if a person who's never had alcohol before has a beer, they might feel kind of tipsy with that one beer. But if they keep drinking beer over time, I mean, like it takes 2 or 3 beers over a period of time for them to have the same experience they had with one beer when they first tried it. So that's what tolerance is, increased need for a drug to have the same effect. Then there's withdrawal. So withdrawal is a body reacting to basically having the drug present in the body, and it's like it's not there anymore. Suddenly that withdrawal is intense. Now, if you remember back to chapter 3, I said that alcohol will stimulate the release of GABA, which relaxes a person. So if a person gets into a habit of having several drinks in a day or whatever, if they suddenly stop that, their body is going to want that drug at the same time of day. And like it will actually stop releasing GABA, saying, we're waiting on the trigger to release this GABA, and the person will become more and more and more and more anxious. So that is what you see in terms of withdrawal symptoms. They start craving it desperately and become incredibly agitated when they don't have the drug. Same goes for nicotine, cigarettes, when a person stops that like cold turkey. So these are 2 symptoms of drug use that I'd like you to be familiar with. If you look at this list of drugs in class, I often ask you look at the different types and consider for yourself which one you think would be the most dangerous and least dangerous in this list. Is another way to view the drugs. You have stimulants, depressants, hallucinogens as 3 major classes of drugs. Stimulants including nicotine, caffeine, and cocaine, Ritalin. Depressants including alcohol and like things like Xanax, and hallucinogens. And you see there's overlap between some of these. Some fit in multiple categories, including marijuana. I'm just going to talk briefly about 3 drugs. And the first one is alcohol. I do not expect you to memorize these statistics, but I just want to give you a sense of how common alcohol use is. So a binge drinking episode means the person has more than 5 drinks at one sitting. So if that's called a binge drink episode. And basically what you see is that about a quarter of the population, adult population, binge drinks at least once a month, and 7% basically have 5 or more of these binge drinking episodes in a month. So that's a lot. And if you see, this is obviously we covered this in chapter 3 in the picture of the brain. Alcohol use, first starts working on the frontal lobe, and you're going to see, again, this is where we have judgment and planning for the future. And so you see that impaired. And then as basically a person drinks more alcohol, the effects just run deeper into the brain. You start interfering with acetylcholine, which interferes with the hippocampus deeper. And then basically it starts to do a whole shutdown. And alcohol poisoning is a ventral shutdown of the medulla that we talked about in the last chapter, which is responsible for breathing and heart rate. So when a person has severe alcohol poisoning, they die because so much alcohol has been consumed, it shuts down activity of the medulla. Marijuana, we already know that we have natural receptors in our body for anandamide, and THC basically mimics this natural anandamide, and it basically it slows the perception of time, increases blood pressure. So for some people, it stimulates panic and anxiety. Others, more relaxation. And so it stimulates eating and has pain relief. That's one of the reasons it's used medically, especially for people who have cancer. It can stimulate appetite if the side effects of chemotherapy basically ruin their appetite. If you look at this, I just highlighted 3 numbers here. This is trends from 2019 about how many 12th graders basically say they have used marijuana in the past year, past month, and use it daily. So in the past year, 35%. The past month, you have about 22%, and daily 6%. If you look at adults, then in the past month, from 18 to 25, you have almost a little over 1/5 of people saying they use marijuana in the past month, and about 8% of people over 26. Keep in mind, with substance use surveys, people can lie. And so it might be that these numbers are even higher, and especially in states where marijuana is now legal, these numbers are probably considerably an underestimate. Last drug I want to talk about today is methamphetamine, and it has the same effects as cocaine, but tolerance builds quickly. Sometimes people need, I put up here, as much as 200 times the initial amount taken to have the same effect that they had when they first took the drug. Now, one of the things that happens with this, it blocks absorption of vitamins, and that can lead to an intense decaying of the body. So if you've seen people who've done meth for a long period of time, you can see that it looks like sometimes they almost look like corpses, and they lose their teeth. There's a lot of skin picking that happens with that, so they also have sores and lesions all over their face. I talk about meth, so it's a stimulant, clearly, because when you look at, this is from about 10 years ago, meth lab busts that have occurred by state. For a long time, Missouri was the #1 state with the most meth lab busts. And so there's I'm trying to remember the ingredient that can be gotten from some chemicals used on farms and fertilizer, I believe. And so since Missouri has so many farms, that's one reason. Also because in southern Missouri, there's so many hills, meth labs could be tucked away in little nooks and crannies. And so the number of meth labs busts in Missouri was huge. It's a dangerous drug, very addictive, very hard to quit. And what they show in the research is that it causes a dopamine surge so ridiculous that it's like the brain is just like bound and determined to do whatever that drug wants. So you see people like basically giving up their jobs, their life, their kids, because of the powerful addictive nature of this huge dopamine rush that happens. That's all I have to say for dreams and drugs today. I hope this has helped.